So then moving on to the vitamins and minerals, breast milk is the perfect food with the exception of vitamin D. So babies who are exclusively breastfed will need to take a vitamin D supplement. Breast milk is lower in sodium, and the type of iron and zinc that is available is highly absorbable. Let's talk about contraindications to breastfeeding. So this would be alcohol. If mom is breastfeeding, then that alcohol does get transmitted to baby. The peak concentration is about 1 hour after consumption. So there is a method that moms can use if they do want to consume alcohol. And those of you doing the case study, you'll be asked a question about this. It's called pump and dump, where mom will consume alcohol, and then at about an hour later, when there is that peak concentration, she'll pump her breast milk and then just dump it down the drain. It's tough because if moms really struggle with milk production, it's hard to see that breast milk go down the drain. But it is better than having that child affected by the alcohol. And you can find more information about that in that position paper from the Academy. And then I also linked a really interesting podcast. It's about 20 minutes in the content for this section. It's a CDC recommendation, and in 2016, they came out with rather firm and fast guidelines that women of childbearing age, listen, not just pregnant women or lactating women, women of childbearing age should avoid alcohol because of the impact that it could have on their future babies or their babies. So really, if you're interested and you want to listen to a great speaker on this topic, listen to that podcast, when you're driving on the way to the grocery store, on the way to school. Pull that up and listen to that because it's great information. And then also tobacco and caffeine that can cause increased jitters in the baby, poor sleep. Moderate consumption of caffeine is okay. Same thing as we recommended with pregnancy. But tobacco smoking does decrease milk volume. It decreases the fat in the milk. So that also has an impact on weight gain for baby. And then keep in mind, just like with pregnancy, that secondhand smoke can lead to unexpected death, poor growth, hearing impaired, and breathing difficulty for the baby. More contraindications would be medication and illicit drugs. Um, if mom does need to be on birth control, it's recommended that she's using progesterone-only contraceptives because the estrogen in oral contraceptives decreases milk production. And then moms and doctors just need to weigh the cost benefit of medications um, while they're breastfeeding. So, for instance, if they're taking medications to control their diabetes or high blood pressure, the mom and the doctor may determine that the risk of those medications being transferred to baby is worth having mom's blood pressure or diabetes under control. Again, just discussions that each mom and caregiver and healthcare provider needs to discuss. Illicit drugs will transfer into the breast milk, so things like marijuana, just like with tobacco, we are exposing that infant to nicotine and marijuana. Now, maternal illness that can be transferred via breast milk would be a mom that has active infectious tuberculosis, and then also HIV infection. Um, this is where we really need to weigh the pros and the cons. For instance, in third world countries where infant formula might not be available or safe water might not be available for the mixture of the infant formula, then mom with HIV breastfeeding would be a better choice. But still, that's something that needs to be discussed and weighed in for mom and healthcare provider. Let's talk about some of the barriers to breastfeeding. Lack of information and role models.